Hello, Dr. David Murphy here. I'm out in Newfoundland on Robin's Head, and I'd like to talk about pain today. Give you this wonderful backdrop too to go with my words. And pain is not what everyone thinks it is. Not quite as simple as we think it might be. I might hit my thumb with a hammer, and chemicals are released in the tissues there that say there's been damage, and those chemicals trigger part of the sensory system that has pain fibers, and that pain signal is sent up to the brain, and I say ouch, or perhaps another few choice words. It's not that simple. It's much more complicated than that. And if we just try and treat chronic pain as if it's as simple as that, it tends to be, well, not satisfying for either the patient or the clinician. And what we need to do is, if I was thinking of an analogy, I would think of a live sports event. Imagine there's a live sports event on TV. It might be football, baseball, who knows. And the cameras are taking in all the action. But there's different cameras from different angles, all seeing the plays quite differently. And then there are commentators. You might have a play-by-play commentator and a color commentator, who again all have different points of view on the information that's coming from the cameras. Both the sounds, the images, the expressions on the players' faces, and then all that information is then also altered and managed. Colors, goes through equipment, computers, and then gets sent out along a long cable or perhaps through airwaves to your television. And then your television processes that information. And you can play around with the controls on your TV, make it louder, make it quieter, make it more colorful, make it black and white. You have all those things going on, and that's what happens with pain. That signal that comes from my thumb that goes up through the brain goes through all sorts of switching stations in different parts of the brain, and it's sent out to different parts of the brain. And then we add emotions to it and thoughts. We have a color commentator, a play-by-play commentator. We have a commentator that brings emotions into the play. And so if we just treat it with things like anti-inflammatory drugs like ibuprofen, or with morphine-like drugs, narcotics, you're only dealing with bits and pieces of that signal, that complicated message that's coming up to the brain. So it's really important to address all of those, that the pain is not only a physical experience, it's an emotional experience, it's a mental experience, and all of those need to be addressed in different ways. So taking pain medications alone is probably going to give you an unsatisfactory experience if the pain goes on for a long time. I'm going to talk about this some more with some other videos. Talk a little bit more about how we can manage pain, the many different ways of managing pain. And remember, of course, if you just take the medication of the pain, it doesn't take the pain away. When I was treating post-operative patients and I gave them morphine after their surgery, the morphine doesn't take the pain away. All it does, it makes it seem like it's just not bothering you as much anymore. And that's important to remember too, that the sensation doesn't necessarily go away, but you can modify the sensation by how you think about it, how you feel about it, the emotions you experience, and all the other factors that come to play. They can be managed by you. So this is Dr. David Murphy signing off. Ted, this one's for you. Bye for now. Stay well, stay healthy.